Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center, Ask the Doctor Anything. And today is July 29th, 2025 at 6 o'clock. We meet every Tuesday night from 6 to 7. And you can get a hold of us by going to our website, tlcdoctors.com. And there you can join our newsletter, and you'll get a link, and then you can give us some of your emails, questions, and then you can go on the live chat here and type in your question there. We are trying to do this for educational purposes. Every week there's general questions, family and friends, and we make this as a sort of a general information resource for everyone. And then we want to get this typed up so it'll be on the blog. And you can run through the questions and you can kind of glean through it. And, the ones that interest you, you can read them. I'll try and answer them to the best of my ability. I'm a general practitioner with about 45 years of practicing medicine as a integrative doctor, even while I was on active duty in the military. However, I grew up with a father in food research, so I have, and now being almost 72 next month, I will have probably, since I was 4, in the office of the food research labs and taste testing area when they were developing TV dinners. I've been around food and food research and listening to the scientists for about 67 years, for sure. So I've seen the whole gamut. Praise God, He's put me in a wonderful place. And I'm here to share that with you and to encourage you and to encourage everyone in the healthcare field to continue to grow in your knowledge and wisdom and taking care of your wonderful bodies that God created in His image. So let's see, we're getting some live questions already. So I'll go to the live first, and then I'll go to these email questions that I have here. Pilar Love says, do you believe hydrogen water helps the body? Yes. Someone told me their hydrogen water bottle by Echo helps their arthritis. I'd love to know what your thoughts are on this. Thank you, Dr. Rita. Well, first of all, most of us don't drink enough water every day. We are so pampered. We have so much income here in America. We are thinking everything should be entertaining. And so water itself is not entertaining enough. So we don't drink enough of it. And the water is becoming damaged with, we're all getting bits of birth control contamination and prescription medicines contaminating our water supply, even though it goes through treatment facilities. It's getting heavy metal contaminated, herbicide, pesticide, plasticizer. Many, many things are creating challenges for our water. You should all filter your water. I have mine here in a Berkey filter, and at home as a Berkey filter. I also have a reverse osmosis that I use. So I try and double filter my water. And then on top of that, I use what is called this Analemma wand, which is this wand right here that's in my water bottle. It is a crystal. It has structured water in it, and you could say that this structured water would amplify your hydrogen. So I'm going to say that all the way back to, I just saw an old video of mine on Valakwa water. That was a water system also that was trying to purify and amplify the positive ion hydrogen ions in the water. And then we had the Kagan water that also amplified the hydrogen ions. And now there are these little more handheld units that generate it. You can get tablets to drop into your water that generate hydrogen ions. You can get it pre-packaged. I have had in the past Izumi, Izumi water. So the Japanese have gone and done a tremendous amount of studying on water. Dr. Lin Ling, Ling, from China. He lived to about 103 years old. He was very famous in his discussions of the many properties of water in the human body, cell, and its metabolism throughout every process in our human body. And then Dr. Gerald Pollack, Pollack, here in Seattle, I think he's in Seattle, Washington, published a book and some video series called The Electrical Structure of Water by Dr. Pollack. And that's the one I ask my patients to watch. And that's where we get this hydrogen water. And this crystal is done as a result of the water research in the Netherlands by Dr. Potts, Potts. And what's the name of this other doctor? Dolph, Dolf Zantigo, Zantingo. Dolph Zantigo worked with Dr. Potts in Europe, and they helped to try and elucidate the science behind what creates that attraction to water to any surface membrane. And what they found was this hydrogen expulsion, and then an OH molecule left that is attracted to the surface. It's called structured water. So you can look up and listen to lectures on analemma wand, which has now put all this structured water into this little wand, and even the bubble won't move fast if you watch the bubble move, because the water is so thick, you might say, in there. It's so structured. If you had my husband's a carpenter, and so whenever he had a balance, that bubble would just wiggle so easily. I can clearly see the difference. So it works through the crystal to teach the rest of my water in my glass there to synchronize in frequency with a structured state and generate free hydrogen. So this will make me more hydrated. It will help me have less joint pain and stiffness. It helps my brain, my skin, my healing, everything work better. My kidneys, my heart, all of it works better. So I'm a big fan of hydrogen water. Okay, Pilar. The next question live is from Jennifer. And she says, hi, Dr. E. Is it safe to use a grounding earthing mat if you are elderly on a blood thinner? Thank you. Well, yes, the answer in general is yes. I had a gentleman who is a patient of mine who has a pacemaker in his 70s. And the disclaimer, I think, on the grounding mats, because they don't want to take any medical legal liability for anything, they're going to say they don't recommend it for people who have a pacemaker, out of the way remote possibility that there could be some electrical mishap. I find that rather ridiculous. And so he sent his grounding mat back to the company, and they refunded him. But I don't see that that's something of concern. I have been around people over the many years of my life. Many of them usually have some form of heart disease, and pacemakers have been around for 50 years. And I have seen quite a few people using earthing grounding devices without any buildup of knowledge of risk. So I think this is just a medical legal disclaimer. So that is my thought. Now, regarding blood thinners, there's no risk that I could even dream of in my imagination from my chemistry, physics, biophysics knowledge. It would only enhance the fluidity of the flow of your blood. It would never make you bleed per se. The risk with blood thinners has always been the older a person is, the more likely for heart disease, clots, and cardiovascular damage. blood thinners, especially in cases like atrial fibrillation, are known to help reduce the potential for clot formation. But then older people are at much higher risk of falling, and falling creates trauma and bleeds, especially if they bump their head with an intracranial bleed. So everything in this life, people, has a price to pay. That's why we're doing these educational videos. And what I've been doing for 40 years is trying to get us and myself and every one of my patients to take personal responsibility for what kind of health you're going to have as you get older. It doesn't just come happenstance. It will come if you drink your water, and if you try and filter it, that'll be better. And if you use some of these hydrogen generating devices, I think the epitome, of course, is the analemma wand doing it now. And then eating a low carb diet, exercising, and uh, water itself is a anticoagulant. So that would be my suggestion, Jennifer, is not to worry about it. I am not going to say a grounding mat, although I have my feet on my grounding mat right now. It gets, when you plug it into your plugs in your house, there's some static, what we call wild type electrical frequencies that get in there that aren't necessarily beneficial. If you look at the grounding, we can actually pick up the noise. We can amplify the frequency sounds if you're standing outside, like on wet grass, and it has like a hissing, little tiny hissing, monosyllabic kind of tone. But if you're in your house on a mat, it's like a loud crushing kind of sound, showing the static. But you are nevertheless getting some grounding benefits from your sheets or pillowcases or your mats that you plug in. Yes. So hopefully that helps you, Jennifer. Beth, I've been taking Fibrenza systemic enzymes. I'm not familiar with that brand, but you recommend Vitalzymes, but they have several versions. Which one do you recommend? Also, any suggestions to raise a low white blood cell count? Thank you. Well, the owner of Vitalzyme came over maybe about 10 years to my clinic, because I'm probably the biggest American physician prescribing Vitalzyme in the nation. And he asked me how I could improve this, because enzymes reduce inflammation, and inflammation is the big enemy of aging and our health. And his product is more costly. So I asked him to create a Vitalzyme that is maybe reduced in price. So he just really just made smaller little capsules and put less in them. But really, therapeutically, you've got to take enough. So there really are different types, in my opinion, of Vitalzyme. They are just the size of the capsule or caplet, and dosing. So I think Vitalzyme is the most researched enzyme out there in the world. But with more and more knowledge coming now, after all the decades of the old doctors like myself promoting these things, we're getting more and more people recruited into more mainstream research and getting good news and information from the studies from this. So I can't speak to the other one. Maybe it'll come up. Maybe it'll be a very good product. But again, we need clinical studies. I have to live with the fact that I wasn't supported 40, 50 years of my practice with research data. And when I could find it, I stuck with that product, and I did see the results. There are unfortunately people in marketing and health that have no moral base. Whatever they can do to sell you a procedure or a treatment of anything, and they'll do it. Um, uh, so you'll see all kinds of nutraceuticals out there making wild claims, and they're just going for the short-term gleaning of money. It's like going out and trolling for fish with a net and just taking in a big catch. So there's a lot of corruption in the alternative world, folks. But yeah, I hope this fibrenza is a systemic enzyme that is good, but until I see human clinical data on it, I can't speak to it. What will bring your white blood cell count up? Well, exercise will, a low carb diet will, because all sugars, fruit sugars, and excess starches, which Americans typically have too much access to, will lower your immune system and white blood cell count. So begin by lowering your carbs, fruit sugar, and starches every day. Stop eating late and exercise. And then the next thing I would do is probably start using EDTA chelation therapy to remove the immunosuppressive impact of our heavy metal toxins that we are breathing and eating in every day. Find a good ACAM doctor or a functional doctor that knows how to use EDTA chelation therapy. That's ethylene diamine tetracetic acid to help you reduce heavy metal toxicities. That'd be a good start. The next live question is from Dennis. Dennis says, my family doctor recommends avoiding fried foods. Well, good. Is there such a thing as a healthy fried food? I don't know of any. So my answer is no. So there you have it. Now, I know beef tallow will do less damage because it's all saturated fats. So it's the trans fatty acid, hydrogenated fats, particularly of linoleic acid, and that's why it gets such a bad name when they hydrogenate these fats. And there's fats we have to have our, our soft skin. So when they do this hydrogenation, and that's what my father did at Armor Food Research, he realized all these seed oils, Crisco oil, corn oil, he would just yell at my mom and say, we're not going to have this, no margarine. So I don't know of any good fried food. Sorry. Let's see. George says, I'm 90 years old, anemic, and my body doesn't assimilate iron, and iron infusions no longer improving my hemoglobin, iron, red blood cell counts for 20 years. Also, I had a gastrectomy. Well, George, yeah, you were on one of my questions here. Okay, so I'll answer it now. So what I'm going to say is you need to work with a functional doctor, integrative doctor, who has some experience. Find out what your blood type is. Find out if you're an A, B, O, AB type blood. Find someone who will give you clinically researched nutrients. I recommend orthomolecular. I give all my patients orthomolecular for digestion to help them get better nutrition out of their food. And I emphasize a richer carnivore diet with aging to help make available more healthy fatty acids and amino acids. So orthomolecular puts out a product called digestive enzymes, and that's what we sell here, digestive enzymes. I tell people to take 2 to 4 with every meal they eat, especially as you get above age 60, no matter what your blood type. But A type blood needs these from their youth on. And if you're an A, that acid that's in the digestive enzyme may be very helpful for your digestion and pulling out the minerals. The next thing is the digestion of the enzymes will help bring out the fatty acids and proteins so you can help make your red blood cells and the membranes of the cells better with the fats that have to be in the membrane as well as the protein. The next thing is EDTA chelation can reduce the heavy metal toxicities that damage the bone marrow because usually heavy metals are concentrated in inert tissue like the bone and fat in a human being. So EDTA chelation may be a big boon in helping you. Also getting better hydration. If you come in for the IV, they'll put it in some liquid, but you've got to drink your water. That will help. Taking antacids with a good multi-mineral, Albion mineral amino acid chelated. Our product is called TLC Multimin. You have to have minerals as God's pots and pans to make red blood cells. And you have to have the B vitamins as cofactors also in the equation for making your new molecules and constructing new tissue and cell membrane. So you need a multimineral, you need a multi B complex methylated, you need the digestive enzyme, you need EDTA chelation, you need a good functional doctor to kind of help figure this out. Of course, you probably should see your internal medicine hematologist as well. You might need B vitamin injections as well because you had some kind of gastrectomy issues. So those are the starting points that I would go, George. Then he goes on to say 3 years ago, he had an aortic dissection and emergency open heart surgery. I've had AFib for more than 3 years. My iron has actually dropped since my last infusion. What can I do? Well, all those things I just said. But you have to remember, we're not getting, I don't think, enough vitamin C. Vitamin C is very important in the elastin collagen formation to create nice, stiff, pull between molecules and cells, elastin collagen. And if you don't have it, you can break apart and get these diverticula and aneurysm and bubbles and rips and tears and so forth. So I would start taking extra vitamin C right away, just as a preventative. EDTA chelation therapy helps thin your blood. Eating a more carnivore-like diet will help the lining of the endothelial lining of your blood. Find out whether you had that COVID vaccine mRNA with spike protein. I've been doing spike protein antibodies. LabCorp just came out with that about a month or two ago. And I'm finding some of the people having quite elevated spike protein antibodies, even years after this shot. We're talking in the tens of thousands when it should be like 1,000 or less. So we have some issues there irritating the blood vessel lining. But yeah, find out about that and find a good anti-aging functional medicine doctor to help you. David Hertzberg says, were the harmful effects of sugar known by the food industry during the time your father worked? Absolutely, David. Yes, they certainly were. And there was a guy by the name of Yudkin, Yudkin. He wrote the book Pure, White, and Deadly, and that was published, I think, in 1959, maybe. Anyway, Daddy had that book when I was a little girl, and it was like verboten in my home. Of course, there wasn't food sold at the gas stations and junk food everywhere, and we didn't have the access to candy machines and paid school lunches and stuff like that. We brought our own lunches, and we didn't have all that sugar. So Dad didn't worry about us so much, but he worried as when we got into the 70s. He really saw the damage occurring. And yes, they knew it. And yes, they suppressed the scientific publications. Dr. Enig, Enig, was a PhD. I don't know, I think she was at Princeton. She was a biochemist. She is referred to in the YouTube video by Sally Fallon, who's the head of the, what is the name of that organization? That the dentist, I forget the name of that organization. It's a wellness organization, West something. Anyway, she put the YouTube out there called Oiling of America, The Oiling of America, The Oiling of America. And Sally Fallon presents the paperwork and lecture of Dr. Enig. And when my dad was in the food research area, they were aware of the suppression of all the beneficial aspects of cholesterol, that it could not be associated with the causative accusation of heart disease, and they suppressed that research. So it's just a real mess there in Washington of money-hungry politicians. God help us all. Uh, Beagle Mom says, do digestive enzymes give you constipation? No, they shouldn't. They should assist in the breakdown of the fats and proteins for your body to assimilate them. If you're a pure carnivore, that may help your body to repair lots of injuries. But eventually that comes to a solution if you're eating enough carnivore diet. And then maybe after a couple of weeks, then you should start moving your bowels more regularly. But I have not seen digestive enzymes be the cause of constipation. Make sure you're drinking enough water and motion. Our bodies need motion. We're in our exercise clothes, so we got to do that. Great is thy faithfulness says, what tests do you recommend are most essential to evaluate thyroid function? A physical exam and history with a good doctor that listens, who can feel your neck, look at your body type, examine your body, your weight, your blood pressure, find out how active you are, what your lifestyle has been like. Are you primarily a sitting at a desk doing work? And then, of course, on lab, then you would get the thyroid stimulating hormone, most especially the free T3, and free T4. The precursor is free T4, but the actual hormone is free T3 triiodothyronine. And most doctors never do that. There are thyroid peroxidase antibodies and there are thyroglobulin antibodies that can be done. There are other rare and more exotic tests out there, but that's the foundational thing. But I really would like a foundational thing to be a 24-hour urine iodine challenge test where you take iodine, 50 milligrams, and collect your urine for 24 hours. And if your body is deficient, and 96.7% of all of us in America are deficient because of our lousy, lobbyist paid off Congress pimping to our congressmen and senators in the food industry to use cheap foods, and they got rid of iodine and they put in the stupid bromelain. Anyway, and then they fluorinate our water and chlorinate our water. Give me a break. Who can have a brain left in this country with that much assault on human physiology? But I think a 24-hour urine iodine test challenge with 50 milligrams, and then you'll hold on to all that iodine. And so when we collect the urine, you'll probably only pee out 60, 70% of it. And if that's the case, then you are iodine deficient and your body held on to 20, 30, 40 percent of that dose of iodine it was so happy to get to work. Beagle Mom said, I have chronic constipation due to extensive surgery and low transit time. My integrative doc told me to take Swedish bitters and digestive enzymes. I also take lactulose. Does this sound okay to you? Yes, it does. And you, of course, follow up with them. But again, how much water are you drinking? How much do you weigh in pounds? Cut that in half. That's how much water you have to have every day. I would eat at a regular time frequency, in the morning all the way till 3 in the afternoon and stop. And then I would make sure you're taking good minerals. I mean, a good amino acid chelated multi-mineral. Ours is Albion amino acids, probably the best formulation known out there with the best supports. Because remember, if you're going to have contraction peristalsis, there has to be the ion exchange based on minerals and salts, electrolytes. So you have to have enough salt. You have to have your magnesium, potassium, calcium for these energy potentials, transmembrane energy potentials to occur to move things along. So I would take a multi-mineral, the TLC multi-min. I usually give my patients 3 a day, sometimes 3 twice a day. And that's how I begin to do it. There are many other things too much beyond the scope of this little 1 hour here. But yeah, it sounds reasonable what he's doing, Beagle Mom. Alexander says, some of my friends have gotten the heart CT scan paying out of pocket. Dr. Wolfson doesn't recommend it, but it did find the beginnings of an aneurysm in my one friend in the main artery. There is a YouTube out there by Ivor Kuman, Ivor, last name Kuman, Cummin. He's I think, Irishman. He is an engineer. He's a bioengineer, and he has worked on the development of the coronary artery calcium CT score technology, history, and following the results of using it as an indicator for predictive, lifespan, heart attacks, and so forth. And his work is remarkable. And I would tend to think that he has very persuasive data. So the name of his YouTube is called Coronary Artery CAT Scan Ivor Kuman. I think that's the name of it. Coronary Artery Calcium Score CAT Scan Ivor Kuman. He has a lot of data on the cholesterol, LDL, heart disease question, predictivity of longevity, and the findings. And so I am in favor of it, along with a functional stress test like a stress echocardiogram. Just having the calcium show up is not of itself the only indicator, but it is one of the strongest reliable predictive indicators. But a functional stress test with a stress echocardiogram or a nuclear stress echocardiogram. But then the more you start doing these things, you start getting into too much x-rays and dyes and stuff. But as a one-time thing, I think it's not unreasonable to do and see where you stand. So hopefully that'll guide you. All right. Beagle Mom says, thank you, Dr. E. I drink the amount of water you suggest. I exercise every day. I eat very little processed foods. I really wish I could find a doc like you. Well, praise the Lord. We're getting more. Just be patient. acam.org, acam.org. You can see if you can find one around you. Most doctors who go for chelation training have open minds and I started somewhere. I didn't know everything I know. So had you met me, 40 years ago, 44 years ago in the 70s, 80s, I probably would have been very forward thinking compared to my colleagues, but I didn't have as much experience and wisdom and resources of quick thinking and treatments that I would put available. But get those multi-minerals. I would start there, multi-minerals faithfully, and fill up all your little mineral needs in your body because you pee them away every day. Okay, let's go to some of my questions. So we already answered George's history of his 90-year-old anemia. Scott says, what are your thoughts about intermittent fasting and living healthy? Well, I'm all for and have been recommending intermittent fasting. Of the past year or so, I have been more aggressively saying we need to, especially after the age of 60, try and give up eating dinners. Eating robust, rich, breaking your fast in the morning when you get up and having, steak and fish and chicken. Don't let them market to you and make you think eating a breakfast is a bowl of cereal or a croissant or a muffin. This is marketing, and it's selling and making some people rich and the hospital system rich for all the disease it produces. But when we break the fast, we can break it with a nice roast like this. I am doing now my slow cooker in the night, and it is ready at 5:30 in the morning. And then I'm up at that time, and so I can eat. I had roast Monday morning, and for lunch yesterday, I had roast this morning when I woke up, and when I got home for lunch today. Now it's all eaten up. And tonight, I'm going to probably put in a chicken and let that slow roast. That'll last me 2 days like that. And I just don't want to eat in the evenings. I want to try and stop around 3 or 4 in the afternoon. That's why I'm burping a little bit, because I ate. I got done around 2:30. Got home, and so I ate so that I could be done. But I'm 72 now, and digestion is slower. In fact, I forgot to take my digestive enzymes. So here's a case lesson. So here's my digestive enzymes, orthomolecular, private labeled, and how long. It's already 3 hours since I ate. But I'm going to take my 2 vitamins because I forgot. Oops. And I dropped it on the floor. What is it? That the 3-second rule? You can pick it off of the floor, get some good stimulation in my immune system. So keep it near me. Alrighty. So fasting, yeah. That way I will be without food roughly 3 in the morning, and I'll eat around 7. So that'll be 12, 13, 14, 15, 16, 17 hours from my last meal. And then eventually what I really should try and do is bring the lunch to work here. But I really don't have a free moment to eat until around 2. So that's about the best I'll be able to do. And then God will have to deal with it and do the best I can. And of course, do my workout, do my walking of my little dog morning and evening, and try and eat right all the time. So I'm all in favor. The research is voluminously out there that intermittent fasting is associated with autophagy, cleaning up old aged cells, debris, protein complexes that are misfolded, and yes, very, very good anti-aging benefits of trying to go 16 hours, 18 hours at least every day between your feeding times, and trying to not eat late and ending it after age 60 by around 3 in the afternoon is also another very wise thing to do. Krista says, Dr. E, have you heard of the company called Quicksilver Scientific? Yes, I have for years. And most of their products are liposomal, which I prefer due to a narrow passageway. Would your capsules be safe to open and put in water to drink? The answer is yes. I have gone to Quicksilver's. I have one of their products. In fact, let me see it right now. So yeah, they dropped off stuff. So you can see I am constantly looking at their Quicksilver ultravitamin. They got a spray for copper, liposomal. And so what I did is I'm looking for data on their product. Of course, they're talking about a micelle formation. This is what liposomal means, to have amphiphilic material. So the outside loves water, the inside tails love fat. So it's amphiphilic, 2 different ends to the same molecule. And so when you dump that in water, they'll all arrange themselves into a ball with the fat on the inside, fat loving, and the water loving oriented to the outside. So I've been involved in this research, and I'm published in it for many decades. And yes, this is smart to do, and that's why I love telling people to eat their protein and fat. because that's what we're made of, folks. We're little bags of cells with water in it that is now electrically structured so that the water in your cell is more like an egg yolk than it is drippy liquid water. But when I look at this company, Quicksilver Scientific, I'm trying, and I have looked in the past. The only product, I have not seen any of their products themselves studied. In other words, they're talking about, they might even be quoting my research on phospholipid membranes and cell health and energy maintenance. But where's their product in the study? Whereas, like, for instance, Juice Plus has, 45 or more, and it's just been selected again at the NIH to be promoted in a research study for antioxidant longevity. So they're talking, like what I'm doing. I'm teaching. Where does it go? They're teaching about phospholipids that I've been teaching, and I have my pictures up on my desk every time you come in and see me. But I'm asking the question, where's their science? Where's their science on their product? They're saying, we did liposomal, and therefore our product has the science we're referring to. I want the science on their product versus, this is what you need to see. I didn't believe Juice Plus. So back in 1999 or so, I was full of myself, but I was doing another doctorate, and I needed a research product. So I decided I was going to prove Juice Plus wrong. So I did a study. I got it published in the American Journal of Nutraceuticals. And what they do is they went through the standard process of a study, all the levels that are involved. And then they did various areas like bioavailability studies. They did on their product. They did dental studies on their product at dental universities around the globe. They did heart health studies on their product. And on it goes. They did immune studies. They did DNA studies. And so you can go and then look up these studies on Juice Plus online. And what you'll find is you can see an entire list of their studies, all those universities, and those reference numbers right there. You can see every one of them, and you can look at this product being studied in the university-based peer-reviewed clinical research. I can't find a single one on this Quicksilver on their product. I can find mine and doesn't, 45 others on Juice Plus. That's why I always take Juice Plus. It's hands down, there's no doubt, it's the most researched out there. Okay, any new questions? Let's see. Garden Fairy added in coincidence question. I had 1 dose of Cipro after urological procedure, and 4 days later woke up extra achy and tired. 6 days now having leg soreness and new back pain. I upped my water intake and taking Vitalzyme. Let's see. So you took 1 dose, but 4 days later woke up. I think that's a stretch, Garden Fairy. I think that's a stretch. Although it is a fluoroquinone, the fluoride is something known to be damaging to the intercalation of the fluoride ion in collagen elastin and allows it to break, so you get ruptured Achilles tendons with these fluoroquinones. It could have some irritation, I would say, but I think you're stretching it to make it blaming. So there you go. That's my opinion. Let's see. PJ, Quicksilver Scientific, I thought had CBD. I don't know if it has CBD products with it. But folks, if all you're interested in is catching the wave and riding the wave out with money's flowing here, folks, everybody start doing your imaging, your website, set it up and claim the wave. We've got the product, sell, 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 rather than having clinical doctors that have used it that can at least endorse the product. But I don't see these products doing it. So that's what I'm looking for because I'm a scientist too and publish. So it's hard to impress me. It's really hard to impress me. So I have a group of lifestyle and glory to God. You know, He's made us fearfully and wonderfully. And we don't need all these super excitable little tiny products. What we need is self discipline, self control. Get to bed, get up, sunrise, ground yourself, get that weightlifting in, get that brisk walk in, uh, eat healthy protein and fat rich menu, do your weightlifting exercise, and then be happy, be supportive. I mean, a good heart, pleasantness, a good mood is always associated with a better immune system, better white blood cell count. That's all already been studied. And, of course, I have the worldview of a Christian, and so I believe in God, and the God of the Bible, and Jesus as my Lord and Savior. And He loves us, and He's for us. And I read His Bible. It calms me every morning, 3 chapters a day, every day of my life, just calms me down, gives me hope and peace to know where I'm headed, no matter what I'm facing. It's just the peace of my life. And it gives me the joy to understand He died. He loved everyone so much, He died for them to pay for their sins. So when I look at a patient, I say to myself, my God, you're made in the image of my God. I better take good care of you. And that keeps my head screwed on and my heart motivated, right, rather than for income and fame and parties and vacations. I just love God's creation. And I don't like this marketing, and I don't like uh, quick grabs and riding some, uh, crazy uh, stardom of some nutrients that really has been around, well, since creation. But we only maybe just found out about. Very few new things have been found. Hopefully, we'll learn more if more money is devoted to nutritional research, and that's what I think is valuable. Mana says, for cataract, does N-acetylcysteine help? Well, yes, you can't say, I studied chemistry, biochemistry, and physics, and I can't say if God created N-acetylcysteine that it has no function in any part of the body. Of course it does. It functions as an antioxidant. But is there a specific nutraceutical research that will say it is valuable in cataract management or prevention? Off the top of my head, I don't know of any volume of research, and I'm every day studying all my life. Now, I'm not. It's not going to harm you. Its history classically is in the form of a mucolytic. It helps to mobilize mucus to help people expectorate. Mucomist is N-acetylcysteine in the form of a prescription medication, usually given to people with chronic lung disease and cystic fibrosis and stuff like that. So yes, it has value in the human body, but if you're going to say what helps cataracts, go get Juice Plus. It's the most proven antioxidant. In fact, what now? I have 30 years of experience. I'm now going to be 72. And I see my optometrist, and Dr. Grant is always pleasantly surprised at just how clear my lens is and so forth. And I just don't seem to be showing that age related change. And I don't have any eyeball, blood pressure, hip pain, joint pain replacement, nothing. Why? Because I've been on Juice Plus almost 30 years, and my father had me eating primarily a carnivore diet since childhood, very low carb. I had to work hard on the farm. These things do pay off. So, yeah, there's nothing wrong with it. Yeah, carnosine, N-acetyl carnosine. These, it is not um, in and of itself, it's not a prescription medicine with a big bang at the end. It's part of a whole multi system of God's great creation. We definitely will do well to do all those healthy things I've been always saying: a good night's sleep, stay hydrated, natural hormone replacement, get up with the dawn, get yourself grounded, do weightlifting, mostly carnivore eating. Um, Use your certain nutraceuticals because they've raped the soil and made the food so useless and pimped all this carbohydrate at us and all this fried hydrogenated fat, and your vitamin D and your enzymes, and these are the things that will make the difference. Okay, please answer my email question. Okay, so Constance, let's see what your there it is. Hi, Dr. Rita. Do all the natural No, I do all the natural time and take extra vital sign. I do all natural all the time. I see. I do all natural all the time and take vital sign when needed. But I have really bad low back pain and icing is not working. Which is best for a couple of days for pain relief? Aleve, Tylenol, Motrin, or other? 72 years young. Okay, so we're the same age. A sensitive stomach, past kidney stones. God bless. Constance, how much weightlifting do you do? How much resistance training do you do? Do you do this training to hold yourself up, or are you aging and shrinking and your muscles all shrinking? Because there are little muscles all along your spine and your transverse membranes of your spinal to hold you up and your shoulders and to have good posture. And if you are doing weightlifting and crunches and pulls and pushing away and the leg press and the leg extension, leg flexion, and you do that 3 times a week and build yourself up, the back pain usually solves itself. If you haven't had bad back pain up to now, that's what I would say to do. Be very well hydrated, and that's the direction at a gym on the machines. Do that. That's my suggestion. Vital Simon. If I'm going to use anything, I'm going to use Motrin, but I take it with food and I use it very rarely. I try and use it only, at most once a week. If you're using it once or twice a week or more, you need to see a doctor to get x-rays and look at things more aggressively. What's the next question here? Okay, Josie says, hi, Dr. E. For the last 2 months, my ears have been super itchy inside. I'm taking Zyrtec in case it's an allergy. That's an over-the-counter. I think that's citrazine, 10 milligram, yes. Whereas loratadine, Claritin is 10 milligram antihistamine. All right, so he's taking a long-acting antihistamine, and but it's not helping his itchy ears. I'm afraid it might be bacteria or mites. Is there any way of testing for this? Really, you got to go in and have the doctor look inside your ear with the otoscope. As we age, we dry up. We're showering too much. We're bathing too much. We're eating hydrogenated, damaged trans fatty acid fats. We're eating too late. We're inflamed. Our skin gets cracked. And so my suggestion is to eat more like a carnivore and we use the 2 fats a human has to have, which is linoleic and alpha linolenic acid. So it's called clinician's preference. You can get that over the counter or at our store. And we put that also in a liquid, and you could take a little Q-tip and put a drop on the Q-tip and kind of rub the inside of your ear to moisturize it a little bit. But have a doctor look at it first, because I don't know what your ear membrane looks like, and if you're oozing out a serous otitis, low-grade infection, or a bacterial, what's going on, have the doctor look at it. But clinician's preference oil is what I would use. Let's see this next one. Hi, Doctor. This is Simone. Hi, Dr. E. My friend is taking rovastatin, that's Crestor, for high cholesterol. What are the thoughts on this medication? I heard that the medication statin can be dangerous for our health. Thank you. Well, just look it up on the Google or go to a YouTube and watch the video by Dr. David Diamond, PhD, and Dr. Ken Berry called High Cholesterol is Healthy. I think our poor doctors don't have an understanding enough basic science, health science. They certainly don't know where health is. They do know where their money paycheck comes from, and they will honor that pathway and those protocols. But God help you if your doctor will not study and look out for you in particular. Instead, they'll worship a protocol pathway that brings that almighty paycheck to them every day, no matter what. And I think that's a shame. So I've never prescribed a statin in my life. I don't think in 44 years ever in my life I've prescribed a statin. Um, Instead, I've prescribed self-discipline, exercise, not eating late, low carb, certain nutraceuticals, adequate hydration, those kind of things. Uh, it's associated with um, uh, rhabdomyolysis, which is the breakdown of muscles. It's associated with many concerns for memory loss, dementia aggravation, Alzheimer's aggravation. It's associated with preventing uh, HMG co-reductase converting into CoQ10, which is a essential thing needed for your energy in the mitochondria of all your cells. I mean, how dare you say you're going to prescribe something that blocks my mitochondrial energy electron transport system and don't have massive statistical evidence that is beneficial for preventing heart disease. In fact, really, I think the studies say at best you get an extra week of life for all the misery and years you pay for taking that terrible drug, and the muscle aches and the memory loss and many other possible damaging effects. So no, I don't like it. Let's see. Constance, we did that, I think. Yeah, for back pain. Jennifer, last week I asked about using hormone replacement when I have a history of migraines with aura. My understanding is that this increases my risk of stroke or blood clots. Where's that proof? What are the risks involved, and do the benefits outweigh the risks? Is there anything I should be made aware of before starting hormones with my history of migraine and aura? 44 years I've dealt with endless number of women and men with migraine headaches, and many with aura. And I have never had any stroke, heart disease. In fact, my prevalence of disease in society compared to any other doctor around is infinitesimally small, because I won't budge. I'm going to say, look, you drink your water, you take that walk, you get to bed on time, you eat a low carb diet, you eat a richer, healthy, grass fed, wild caught, prairie raised meat, fish, chicken, beef, and you take systemic and digestive enzymes and certain nutraceuticals, and life goes well. The natural hormone replacement therapy I've been using voluminously since the 1980s. And most of the science is just based on poor data, mostly of old equine horse-based serum extracts of their horse estrogens, which are far more powerful molecules. No, really, if you look and Google this, they don't know the cause of migraine. Sorry, these guys, they don't know the cause of migraine. But I seem to get great benefit when I give people progesterone. I give them the enzymes, I give them the water, I give them a food allergies to avoid, find out their blood type. I stop all the wild, entertaining foods and keep it to just specific holiday treats. And the migraines tend to go away. And I put everyone on natural hormone who will let me do it so that they can get all the construction, general contractor, repair, building support benefits of natural hormone therapy. So no, I don't think there's any risk. Jennifer, all right, that was Jennifer. Oh, Christina says, what do you recommend for pinched nerve pain radiating through the shoulder and back? Well, Jennifer, how much do you weigh? How much do you exercise? How much water do you drink? How much range of motion stretching do you do? How much sugar do you eat? How many processed foods do you eat? What kind of a job, stress are you under? What supplements, vitamins do you take? Because look at, like I told the other lady, constants, I said you have to exercise with a crunch and the chest and pull and uh, push and the leg extension flexion and the leg press and the deltoid pull downs. You have to build up all the muscles in your core and your body. You have to drink enough so your intervertebral uh, discs that are only going to get water by you drinking it through diffusion. There's no blood vessel into the discs in between each vertebra. And, you have to see a doctor about pinched nerves if it isn't getting better with doing all these things, and gradually build up your strength so you sit up straight and have good posture and good strength no matter how old you get. You have to keep that muscle tone. Eat a rich protein diet, take digestive enzymes as you age. These are the things you need to do. But if it doesn't go, you have to see a doctor, make sure there isn't, some calcification on it. But all these things would help on the lips that are on the transverse processes off of each vertebra. And you have to check your inflammation markers to make sure you're uninflamed. So if you do those things, you're uninflamed, you don't have bad x-rays with a lot of terrible degenerative changes, you are exercising, but it's still not getting better, then you have to have a doctor screen, for any kind of impingement from a tumor or prior trauma or scoliosis, things like that, to be checking. But in general, we are fearfully and wonderfully made and can self-repair most of the time. Sean says, can you explain why doctors say women who have had a hysterectomy can use estrogen alone without progesterone to control their menopause symptoms? Do you agree? Well, if you're a very narrow-minded, uninterested in researching your own area of expertise as a gynecologist, yeah, it will get rid of your menopausal symptoms to just take estradiol, but then you'll become estrogen dominant. And the thing is, progesterone has receptors on every organ system in your human body. These gynecologists who say you don't have a uterus anymore, so you don't need to take anything but estradiol, they're just ignorant. They're just undereducated, understudied, at best, mediocre gynecologists. You think better, you have better memory, you have better sleep depth, you have better repair of your body, you have a better bone health, you have better immune health, better digestive health, better cardiovascular health, all throughout your body. It'd be foolish to give a woman estradiol and not give her progesterone. Men can use progesterone as well too. Marlise says, thank you. I'm a 73-year-old female. I have unrelenting chronic migraines and I'm very desperate. I've been given many medications because I'm in pain 18 out of 30 days a month. I don't like taking medicine, but I have to. My iron is very low as well, along with panic attacks. Marlise, you need to get a good functional doctor. It's my opinion that we've been successful with helping so many irretractable migraine patient sufferers when we get rid of the inflammation of the body. And usually that starts with the gut. We've been teaching this for 40 years. Find out your food reactions, allergies, find out your blood type, get hydrated, get exercise, get a good night's sleep, get on natural hormones to start general repair, have it monitored, do your exercise, take systemic enzymes, and take the albion chelated minerals. You might need extra progesterone. You might need, some curcumin, things like that. But find a good functional doctor because usually we can help people like you. Vasilki says, I took a food sensitivity 3 years ago. My question is, how often should we repeat this? Do we humans develop new sensitivities? The answer is yes. Should we become aware of and we can overcome sensitivities over time to begin to moderately eat those foods that we were sensitive to? Yes. So in other words, we are marketed to put all kinds of things that make other people wealthy by shoving it down our throat. Social pressure, and the common things that go down your throat over and over and over again will leak through your gut and you'll inflame to it. So they can take wheat and turn it into muffins and pancakes and bread and crust on the Kentucky Fried Chicken and wheat. So if you learn to avoid that, all these processed foods and probably dairy, and just eat cooked vegetables and protein, or just be a carnivore for 3 months, usually all the healing in the gut occurs. So those food allergies that we're just taking advantage of the raw hurt stomach gut lining are going to go away. And then you can use them on a rare basis of exposure. So yes. So I guess we're over time. It's 7:05. I've been having such a good time here. Um, do I believe water pills work? Um, my dad has been taking them, but needs his stomach drained every 3 weeks due to liver disease. I'm wondering if they are making it worse. Christina, there's just too much to try and say there. There's many causes for why that would happen. But in general, the prescription by your internal medicine doctors for serious disease is well studied. And so I would ask the doctors about that. I would have to know much, much more about it to even give some opinion, but I would follow your doctor's advice in the meantime. So God bless, love each other, treat each other like the wonderful people you are. If it's of value, like and subscribe. God bless. Good night.